Hello, hello, good evening, hello all, good evening to everybody. Today you're about to watch the fifth episode of the web series of the Mindspark, Confessions of Brilliant Minds. In this special episode we will explore social marketing and behavioral influence and try to understand how social marketing is applied to help communities be safer, governments design interventions to solve social problems, and hopefully, depending on time, we will close with a review of social marketing in a corporate context. Also, we will have a look at how social marketing was applied or could have been applied to help with the coronavirus situation. To make a short introduction, social marketing, despite the fact that the social value is long before noted, we can say that social marketing evolved as a mindset around in the mid-90s after Weber's famous quote, "Why can't we sell brotherhood as we sell soap?" This publication triggered a new dialogue on how we could use marketing to help people. We could say in Greece that the first social marketer is Kapodistrias when he tried with a very inventive way to add in Greek diet the potato. However, Greece today is left behind in using holistic approaches to social change, as social marketing being one of them. Existing social change campaigns in Greece typically fall into the category of health communications and social behavior change communications, some of them, as they lack certain criteria to be considered social marketing in terms of approach, methods, and tactics. The case is that today more and more advanced nations exploit the potential of social marketing. The UK pioneered, having launched in 2007 the National Social Marketing Association under the lead of Professor Jeff Friends, who we are honored to have him today with us. Later, a Behaviour Insights team was established, and today their work spanned to 31 countries abroad. But what is social marketing? How is it so different from existing approaches? What makes an intervention comply with social marketing principles? And how advanced nations exploit it efficiently are some of the topics we will explore. For all these topics, we invited global thought leader on social marketing and behavioral influence, Professor Jeff Friends, to help us better understand the principles and applications of social marketing and help us have a better understanding of what we need to drive behavior change. Hello, Professor. It's great that you accepted our invitation to be here with us today.
It's a pleasure. I'm deeply honored to be invited to speak with you today.
We're very delighted to have you here. You are one of the top experts globally on this field, and so we will seize the opportunity to have a better insight on social marketing. So in the first part, we will start with an introduction to social marketing. It is wise to start with defining what is social marketing. Most social marketing professionals admit that when they discuss about the field of their work, they receive a response like, "Oh, I know, Facebook, Twitter, social marketing." So that is wise to discuss. You are a global thought leader, so you are the perfect person to make these questions, to define it. What is social marketing, Professor?
Yeah, well, it's a good question, and those words are used a lot around the world in different contexts, and they mean different things to different people. But when we say social marketing, I guess what we're not talking about is just social advertising or social media work to promote health or other aspects of good social policy. What we're talking about is the application of marketing principles to create social good. And there are a number of those principles like value creation, exchange, segmentation, and so on, that we can apply to make more effective, more valued interventions that get a measurable positive response from the population. So it's about using marketing principles and concepts to create more effective and efficient programs, but also programs that are more ethical and ones that appeal and get a positive response from citizens. So that's what we're trying to do. Use marketing alongside a few other techniques and methods of intervention from other aspects of social policy delivery, but underpinned by these marketing principles.
Great. I will seize the opportunity to read one of my favorite quotes of one of your latest books, The Social Marketing in Public Health. You say that over the years, public health has developed impressive data gathering systems related to mortality, morbidity, and health sector utilization. However, we have invested much less time and effort in developing methodologies to generate deep understanding of the wants, fears, needs, motivations, and barriers of people face at either haste or detract them from their ability to live healthier lives. In short, you close it a very impressive way. In short, we are fantastic at counting the sick and the dead, but much less adept at understanding the living. What did you mean with this?
Yeah, I come from a kind of public health background originally. I'm a biologist by background. And in the public health system, as we're seeing with COVID-19 at the moment around the world, we have fantastic data collection systems for understanding the epidemiology of that disease, and they're improving our knowledge day by day. We have great demographic data in lots of countries, understanding the age profiles, socioeconomic class, occupation, and so on. And so we have a lot of data about what is happening, but we have much less data and understanding, and we invest much less in gathering data about why people do things and how we might help them to behave in positive ways, or in the case of COVID-19, ways that would protect them and their families and the rest of the community. So there's a deficit, I think, in our understanding and our research investment in understanding the people that we're seeking to influence from a perspective that they can bring. Their understanding and knowledge, their fears, their hopes, their aspirations, about and information about what would help them to change or adopt a behavior and maintain it. What we tend to do is use those other data sets as a proxy for that deep understanding. I'll give you kind of a practical example.
That would be great.
In many countries around the world at the moment, a great deal of research is taking place, and this is very, very valuable, driven by epidemiologists and public health professionals. In some countries, people with an understanding of influencing behavior are also being involved. People like psychologists, sociologists, and anthropologists. Mm-hmm. But very few people, governments and public health organizations, are engaging marketing organizations and people with social marketing skills, even though the people that work in this field probably know more than most other fields about how to understand people and then how to develop intervention projects and programs and campaigns to persuade them to behave in particular ways and to keep behaving in that way. So for me, there's a big deficit at the moment. We know a lot. We have 40, 50 years plus knowledge and evidence and research and learning in social marketing about how to tackle some big social problems, mm-hmm. and that is not being applied as well as it should be. Issues like family planning, reducing overpopulation, protecting people in relation to malaria, reducing smoking rates. All of these have had been big successes around the world, tackling some very complex issues, and they've all applied social marketing principles as a big part of the solution to some of those problems. So at the moment, I'm a bit frustrated that globally we're not using maybe social marketing as much as we should. There are some good examples
Yep.
out there, but there needs to be a much wider application, I think.
Great, great. In the past keynote you discussed, I'll take the opportunity to ask you again, that less than $1 out of every 100 of government spending is backed up by even the most basic research. This is related with the use of social marketing in terms of insight-driven approach.
Yeah, very much so, because one of the kind of key features of social marketing is the setting of explicit, behavioral goals. Now that's one, so we can track and learn about the most effective way to influence people and feed that back into continuously improving a program, so to make them efficient. But we also, in social marketing, want to look at effectiveness, and kind of payback, if you like, value for money. So what we're interested in, as well as whether programs work or not, are they efficient? Are they effective? We also want to know whether they're efficient as well. So is it the best way, to spend the money? And good social marketing, it sets out clear objectives with metrics to measure progress towards those. But it also measures what return on investment there is. A good example that's been very well written up is in the field of road transport safety. There's a program that's been running in the UK now for about 15 years through several changes of government, and it's focused on reducing road deaths and accidents. And it has very rigorous targets for different population segments in terms of reducing road accident deaths from cyclists, motorists, pedestrians, and so on.
Mm-hmm.
And that is tracked on a regular basis. But it also has a very strong measurement of the efficiency of that program in terms of return on investment. And what the economic evaluation of that program shows, alongside the effectiveness evaluation, is that for every £1 that you spend on that program, you get about £60 back in terms of social value. So social marketing is interested in developing programs based on a deep insight of what will help people and what's possible. It's interested in tracking and measuring whether those programs are being effective or not, because if they're not effective, then we stop them. But if they are effective, we also want to know is whether that's the best way to spend the money or not. So, return on investment, cost-benefit analysis, value for money analysis are all part of good social marketing practice as well.
So we're discussing about making even the government more efficiency. That's why we're more efficient in terms of
in times
programming.
Of economic constraint and the cost again of dealing with the COVID pandemic will be huge. Probably in the lifetimes of everybody listening to this podcast or this program, there's never been an economic shock like the one that's coming over the hill very quickly. So we're going to need, governments are spending a lot of money at the moment to mitigate the worst effects of COVID-19. But money is going to be in short supply going forward. So we need to make sure that every £1 we spend on social programs is money well spent. So, cost benefit analysis, value for money analysis, return on investment analysis is very important. And it's one of the principles, again, that's drawn from marketing. If you work in a marketing department in a commercial organization, you want to know whether the money you're spending is having an effect or not.
and learn something, not to do it again, or do it better, or do it again as well. It's great. I'll seize again the opportunity. You discussed about the criteria. I know that over the years there were developed some benchmarking criteria, starting from 8. You developed the 6 criteria, and this will help our audience to understand that criteria mainly was about benchmark if you are on the right path, correct?
Yeah.
So,
okay.
Could you discuss it to help?
Those? Yeah, there are kind of 6 there's been a lot of work over many years in social marketing trying to define the principles of best practice, if you like, a kind of recipe for developing more efficient, effective, and ethical programs. And there's a kind of global consensus now that really there are 6 kind of design principles, if you like, for social marketing. And the more of these things you do, the more likely it is that your program will be efficient and effective and ethical. So I'll kind of lay those out for you and give you some examples. What's worth saying is that to do all of these things is not easy necessarily. It takes effort and time and kind of planning to do that, and commitment. But what we know is that the more of these things that you do, the more likely it is that your program will work, and it will be acceptable to your audience, and it will be ethical. And we also know, not just from research within the social marketing field, but also from many other fields, there's corroborating evidence that the more of these things you do, the more likely it is that your program will work. So just to lay them out fairly kind of basically, the first thing is citizen orientation. You need to make sure that the program is built around a deep understanding of the community that you're seeking to serve and the individuals that you're seeking to serve. And those people are engaged in the development, delivery, and evaluation of interventions. I'll give you a COVID example. Finland is a really interesting country at the moment, if you're watching what's happening in terms of that country and the way they're tackling COVID. And their approach is very different from many other countries. They don't have a lockdown as such. People are voluntarily locking down in some instances if they're in vulnerable groups. But the government is engaged with citizens, and it's had an adult-to-adult dialogue with them about what people need to do and what kind of social distancing measures they need to put in place, for example. And they've managed to avoid a lockdown on some of the economic impact, a negative impact that will have, by developing a dialogue with and working with their citizens to take appropriate preventive kind of measures. So the first principle then is citizen orientation and engagement. The second one I've already mentioned, and that's setting explicit goals that you can measure and track to see whether your intervention is working and whether it's an efficient way to spend the money. The third principle is delivering tangible value. This is a key marketing principle. Unless people see value in what you're trying to persuade them to do, they are not going to respond to that, particularly in the long term. And actually, in terms of COVID, lots of governments have set out, a valued offer to people, i.e., you won't become infected if you do things like social distancing, washing your hands, and covering your mouth if you're sneezing. So, create value for people is the third one. The fourth one is using evidence, data, theory, and what we call insight, psychological and sociological studies about why people do things, to create a targeted, segmented approach. So rather than one size fits all campaign that you just give to the whole population, increasingly you focus your attention and your programs in a more tailored way to the needs of particular groups within society. The fifth one is competition and barrier and asset analysis. So what this principle really is about, understanding who or what is stopping people taking up the behavior that you want them to. So that's understanding the barriers to that behavior and who might be pushing in an opposite direction, and doing something about that as well as promoting positively the behavior that you want people to do. And the asset analysis part of this is understanding who you can work with. So what other partners, what other agencies, organizations, cultural institutions, religious institutions you can work with to create interventions that will help solve the problem. And the last principle, the sixth principle, is working in a systematic and systemic way, trying to understand the problem not in simplistic terms, in terms of just straightforward cause and effect, but having a wider view of the problem and some of the potential trigger points for intervening to reduce the size of that problem. So understanding the complexity and the system effects that are impacting on people's behavior. So if we do all of those things, and it sounds a lot, I know, but it is possible to do it if you go about it in a systematic way. What we know from the evidence is the chances of the intervention working and being sustained are greatly improved.
Great. So, social marketing is an holistic approach, can help us to tackle complex social problems and in a dynamic environment. So, the pandemic was something like this, actually. What we can discuss about, can you discuss anything about the social marketing in the period of the pandemic? It's very to discuss social marketing in the context of COVID-19.
Yeah, for sure. There are a few things I'd say about the current pandemic. Obviously,
to help you more, see what do you think needs to happen to persuade people to act responsibly? As some countries start to come out of forced social distancing, some people complied, some didn't.
Yeah, and as countries are opening up, it's going to be interesting to see how people comply or they don't. We're just thinking about those principles we've just been talking about. I think you need to kind of use that as a kind of checklist of things that need to be understood and how potentially to intervene. As you've said, when some people will comply with social distancing and face covering, others won't. And a lot of that is to do with their own perception of their level of risk and whether they are likely to kind of get a negative effect. I wonder if it's possible, Leo, at this point, there's a slide that we have that we
the
can
high
share.
Compliance slide.
Yeah, if that's possible.
Yeah, of course. We've turned it.
Yeah. So is that being displayed now?
Yeah, it's displayed.
Okay. Yeah, well, this is just an example of, as I was saying earlier, if we're going to influence populations are not made up of homogeneous kind of groups of people. There's lots of variation in the way that people will react. And if you look at this slide, you could do a basic segmentation of the population based on just these two factors. First of all, age, younger people, older people, and then in terms of whether they're likely to comply or not, whether that's high or low. We know in lots of countries, young men, for example, perceive themselves to be at low risk, and what the epidemiology tells us is they actually are low risk of not of catching the disease. They have an equal chance of that to everybody, but the chances of them being severely personally affected by that, are quite low. So they're correct in that element of their assumption. Therefore, it's possible that they might actually be at low risk or very low risk, and therefore persuading them to modify their behavior is going to be very different from, say, talking to a group of men who we know gender-wise you're at higher risk and older. So let's say men in their 60s to 70s. They're not in the high risk category, but they are more at risk. Now, do we know at the moment in every country what the perceptions of men in that age group are, and how we might be able to encourage them to maintain social distancing or face covering? It's probably, what we do know is it's probably a very different set of messages and instructions and support between the young men and the older men. So we need to think through as we go into certainly latter stages of the COVID situation, how are we going to segment our population? Because we're going to need different kinds of interventions to encourage people to maintain the kind of positive behaviors that we want them to. And even when we get to a situation where hopefully, within 6 months, a year, if we're lucky, we have a vaccine, it'll then be trying to persuade people to take up that vaccine. And what we know from other vaccine programs is that there will be resistance amongst some people, some subsegments of the population, to the uptake of vaccine on ethical grounds, religious grounds, or some people will just believe, they'll be worried or have fear about, taking up that vaccine. So one message to everybody saying get vaccinated is probably not going to work, as well as one that's more targeted to different subsets of the population. So one of the big things I think with tackling COVID and getting people to comply is one, making the kind of behaviors that we're asking people to do doable, and most of the ones that are being promoted by the governments around the world are, so that's good. But then making them more specific, and using maybe other techniques for younger people. For example, if you wanted younger men to make sure when they go out and they're traveling, they're wearing some kind of face covering, maybe you should give them some face coverings that are free, not ask them to go and buy one. Because if they perceive themselves to be at low risk anyway, they maybe think, oh, it's not worth buying something, I won't bother. But if they're given a free one, maybe they will use it. Does that answer your question?
Yes, sure, of course. Another question is that how do you rate the success of failure or failure of efforts to influence the behavior of citizens around the world? You're a global thought leader, you operate globally, so you've seen different approaches. So we know that governments probably applied made some efforts, applied some tactics, but how could they rate the success or failure of what they did?
Yeah, that's a good point. I think the first kind of response to that is, I don't think we should think about message giving and appeals to behave in particular ways. We shouldn't separate that off from some of the other really important things that government needs to do to protect the population. It needs to be an integrated approach. So, contact tracing, self-isolation, adequate treatment services for people, intensive care bed availability, as well as messaging, are all important part of the kind of package of measures that governments need to put in place. And one without the other is not probably going to be optimal in terms of. So regardless of how good your kind of promotion and health education is, without those other elements being in place, it's going to be difficult. And that's true for things like, one of the key audience groups here are people that work in the healthcare system and in the social care system. It's making sure, for example, one of the big behaviors there is making sure that they use consistently the personal protective equipment in the right way to protect themselves, patients, and colleagues. So to do that, they need specific training about how to do that, and they need access to all of that kind of equipment as well as just being told, to social distance and so on. So it's making sure that all the elements of the program are in place. But I think we've seen some really interesting examples in terms of promotional and behavioral influence around the world. Couple I particularly like, one from Vietnam. I don't know whether you've seen this, but if you just go onto YouTube, it's kind of gone viral now, global. They've developed a very catchy song and dance challenge around COVID that incorporates all the key messages about washing your hands regularly and keeping a social distance and isolating if you have symptoms. And I think that's a very kind of, upbeat, positive way to engage with their population, which is the demographic is relatively young. In a sense, they understand their population, they know what they will react to, and this positive, upbeat music video and dance challenge as a way of getting across the behaviors that people need to do is probably going to be more effective in that population than it would maybe in some others. I've been looking at the kind of informational campaign that the Canadian government have been running, and I think that campaign is actually very good. It's very explicit. If you again just Google Health Canada, and you'll see some of the promotional messages they've been putting out around self-protection in terms of hand washing. There's some great graphics and explanations about washing your hands, which we know is one of the key behaviors, most important behaviors to protect yourself. But how to do that properly, is something maybe all of us, we think we know how to do. But the Canadian government, I think, have set it out in a very clear and concise way that should help people, not just in Canada, but in other places. So those governments that kind of understand their population and have put effort into and have engaged some great health communicators and health promoters in developing those messages, I think have done a particularly good job.
Great. You've published an article advising policy makers on the COVID phases, and I would like to ask you, how should governments and public health agencies alter their approach over the phases, the course of the pandemic? Could you share with us some insights?
Yeah, again, I think we've got a couple of slides here I'd like to show if that's
It's the
possible.
table. Yeah. We just
Yeah, if we
displayed
could
the table.
if we could show the second slide, which is about basically strategy. And so this is a slide that hopefully you can see that now.
Yes, it's a slide with government support. The second slide.
Yeah. So
it displayed next to
what we need to, the current kind of, and the title of this presentation was a new kind of narrative. Where we are with most governments around the world is that the behaviors that are being influenced are, being drawn from, the science of what we know about reducing the spread of viral infections, and epidemiological studies about the state of current infection, and mathematical probability modeling, which gives estimates of the total kind of level of infection in populations and whether it's going up or down, whether there's a spread taking place and at what rate. So that's all kind of expert driven, scientific and data driven exhortations to behave in particular ways. And that I think is entirely appropriate in the kind of early phases of interventions, where this is a new and novel set of challenges. The information, such as it is, and we have big gaps in that information about the virus and how it's spread, but that's been gathered together very effectively by lots of experts, WHO and government public health departments, and shared from experts, to the population, saying this is what we know, this is what you should do. So that's an effective strategy early on. But as we go forward and we're asking people to sustain big changes in the way that they live their lives or run their businesses, we're going to need, I think, a different approach. And this approach is not just about top-down, expert-driven advice to people. It's more about engaging the community in a more adult kind of dialogue, and also looking for solutions that come from the community, not just solutions that come from the government, from top down. So what this first slide shows you is, we need government support for community action. So how can we empower local people, local authorities, local health communities, local churches and other institutions to understand the local problem and create local solutions. Because it's only by engaging people on a local level and getting them to take over and drive the ongoing behavioral changes that we need, that these things will be maintained. Because as we're seeing now, as some governments start to unlock or allow some unlocking of their kind of societies, some people go too far and they interchange too much, and the virus starts to kind of pick up again. So we need local people, local organizations to help, neighbors, friends, communities, to police and enforce and encourage compliance, because centrally, from government, police and public health departments, we just won't be able to do that. So what I'm advocating, not on the basis of ideology, but on the basis of evidence, is that if we want long-term sustained changes in social practice, we need to engage society in creating and supporting and nurturing those, because without that, we only listen to experts for so long before we start doing what we think is appropriate ourselves. So we need that kind of change of emphasis from top down to bottom up and top down, working together. And Leo, could we show the next slide that I think you've got?
Of course, the long-term action.
Yeah.
So we're displaying just a very interesting slide about long-term action.
Yeah, that's great. Thanks. So in here, there are kind of 6 things that I think governments need to do in the medium to long term until a vaccine arrives. And also, some of these things are going to be appropriate when a vaccine is made available, and we start to think about encouraging people to take up that vaccine. So at the top, you can see segmentation. We need a program of behavioral influence that recognizes there are different kinds of groups in society, and we need to target them differently. The next one is a full toolbox of influence. So this is about making sure we've got great messaging, of course, and education, but also that we've got supplies of protective equipment, for example, face coverings and masks, and personal protective equipment for people that work in high risk environments, like doctors and nurses and care workers and so on. So that's about the supply of equipment, as well as education and information. With information, we're already getting lots of misinformation out there, either spread unintentionally by media, or sometimes intentionally by people who want to cause mischief and do harm. So we need to be vigilant in challenging misinformation when it's being propagated by any source, and challenge that. And a number of governments have got now media watch schemes in place, where if they see factually incorrect information being put out, they respond to that. And some of the social media providers are also now starting to track and remove this misinformation, but we need much more of that, and we need a lot more of that, I think, going into the kind of latter phases of this pandemic. The kind of next element at the bottom of the screen there is manage expectations, tackle complacency, and feedback on progress. People need to have feedback about how successful or not the control messages are working, whether people are complying or not. So that's about building a kind of a feedback mechanism with the community, letting them know what's working, what isn't working, and maybe suggesting ways and working together on creating ways to tackle any weaknesses in compliance. If we just move round to the next box, which says open and listening approach to strategy and delivery. This is about working actively with communities and also communities of practice, listening to people that have a lot of information and understanding about tackling this problem. So people, professionals like teachers, social workers, the police, people working in prisons, all of these people have deep understanding in their particular context. That understanding should be gathered in and used to deliver and develop effective strategies. But also people like mothers and grandmothers and grandfathers, they have great information as well and good suggestions for tackling the pandemic. That needs to be listened to and also factored in. And the last kind of box says ongoing tracking and adjustment of the strategy. So this is the kind of obsession, not with just measuring the rates of infection and hospitalization and deaths, but also compliance with the behaviors that are being promoted, seeing which programs are working best in terms of promoting and sustaining those, and also finding the ones that are not working and stopping those. So this is the kind of continuous learning and feedback loop that we need to build in. And there's just one more slide I want to show, Leo, if that's okay.
The table,
If you
yeah,
can go to the
of
next
course.
one, the table.
We just displayed the table about the three
Yeah,
the
I won't
rows.
go through this in detail. You can look at this. I think these will be shared after the presentation as well. What we've got on the left-hand side is a number of kind of generic phases that we're kind of working our way through. So this pre-lockdown phase. So this is when the virus was emerging, and this will happen in countries that haven't been affected to date. Then we have a lockdown phase where governments seek to slow the spread of the infection by instigating social distancing. Next phase is the partial lockdown, where lockdown starts to be relaxed, and this is where most European countries are at the moment. Then we have a further opening up phase for communities where, providing the reproduction rate of the virus is not going up too much, below 1 ideally, then an opening up phase of more freedoms can be instigated. And then we get to a point where we have potentially a vaccine that's available. But even when we have a vaccine, there will be a need for ongoing vigilance, particularly until whole populations are vaccinated. So, and even internationally, all countries and all regions won't be vaccinated at the same time. So there'll probably be, if we had a perfect vaccine today, it would probably take a year to 18 months to vaccinate the world, in being optimistic. So in terms of international travel, there will be some places that are still quite risky to go to, excuse me, or accept people coming in from those countries into countries like Greece and the UK. And the final phase would be a future preparedness phase. And if we learn nothing from this campaign, this kind of pandemic,
Yep.
one of the things I hope we would learn is that there will be future pandemics. So much more effort being put into the learning from what worked well, what didn't work so well across countries in terms of dealing this kind of pandemic, and preparing for the next one, which will surely come. Hopefully a number of years down the road, but it could be next year. Who knows? So the point of this slide really is, and the other columns on this slide look at what behaviors might need to be influenced at each of these phases. The point of the slide is we are going to go through a series of phases where our focus on influencing behavior is going to need to be different. And we need to be planning for that now. So we are in the partial lockdown phase. We need to be planning for these other phases in terms of what we want people to do, how we want them to behave, and how we're going to communicate and support that now. We don't want to be doing it as we're starting to enter into that phase. So there's a lot of work for governments around the world, I think, to do that planning now.
So to be prepared for an upcoming pandemic, right?
Yeah, very much so.
So, because time passes by, I just want two more questions for you. One, I want to recap because you discussed about before about the bottom up and top down. It's very important because if coronavirus and the pandemic left something positive for Greece was that now Greeks trust the experts, and that's very optimistic for us. However, discussing this approach that the bottom up and the top down, the let's say the sweet spot is quite the middle, as we said. So we started trusting the experts, but as we understood, we must pay attention to the bottom as well and try to make a good mix. Is this a right summarization of what you just discussed?
Yeah, I mean, I think one of the positive upsides of this pandemic is that the voice of experts and scientists, hopefully
It's
social
be heard.
marketers, will be listened to more in terms of hopefully speeding up our kind of exit from the current crisis. But even more importantly, preparing for the next one. So having people in positions of authority and influence
Yeah.
that can help prepare for the next pandemic.
That
Hopefully, is a legacy that we'll get
that
from.
have the expertise and are able to hear the people and
Yeah,
the
as you say, I mean that listening to the experts is good, but one of the biggest groups, if the biggest group of experts, are the people themselves.
yeah.
So putting in place systems for working with communities so they are resilient, like resiliency planning for communities, preparedness planning for communities, I think will be, again, one of the big legacies of this pandemic. And I think lots of countries will hopefully invest in that. I mean, Greece has done a great job in this kind of early phase of the program in terms of reducing infection rate. So there's lots of great learning, I'm sure, to be captured from the Greek experience that can be shared with others. And I think part of that is drawing information and learning from communities into the process alongside the learning that comes from expert witnesses.
So another question. I know that you played a part and a role in establishing the National Social Marketing Center in the United Kingdom. I think it all started with a report. It's about our health that you provided, and then it was decided for to the establishment of the National Social Marketing Center. It became a reality because it was the first globally in that level. Could you share some with us your experience because it was the first time a government embraced in that level social marketing.
Yeah, I can say something about that. One of the reasons for that was that there was a government health policy review. And one of the main conclusions from that health policy review was there was a need to engage more with citizens and understand them if we're going to deliver better healthcare services. So one of the kind of potential solutions to that was an investigation about whether social marketing was a set of principles that could be applied to help engage with citizens more. And what the review showed was, I led that evidence review, was that it can, if it's systematically applied. And what's happened in the UK since is we have a thing now called the Government Communication Service, which applies and ensures that those kind of design principles that we talked about at the beginning of this session, those 6 principles are applied, and they must be applied if government funding is going to be used to develop programs to influence people. So the work that we did in the National Social Marketing Centre has now been incorporated into government best policy. And we have in the UK in a few weeks' time the next set of national occupational standards for social marketing. So there's a quality assurance process in place in the UK. And what's interesting is,
Yep.
if you look at some of the health communication, social marketing work that's been done in the UK around the COVID pandemic, it's actually been quite good. The professional input. Some of the political messaging has not been quite so clear, but the professionals have done quite a good job. Some of the politicians maybe haven't been as clear as they could have been. So yeah, the National Social Marketing Centre was the realization on the part of the UK government at the time that they needed a more systematic, structured way to develop these programs. And so we developed the National Social Marketing Centre, which trained thousands of people in these principles. And now these principles are part of standard government operating policy. And the quality of that work is actually quite good.
Is there any other country where social marketing stands today in terms of adoption? Is any other countries adopted social marketing?
I'm not aware of any other countries that do it as such, but many countries, of course, have things like health promotion centres, health education centres, and other forms of government communication agencies, and lots of them apply the same principles. Because whether you call it social marketing or health promotion or something else, it doesn't really matter. I mean, what matters is that you apply the evidence-based principles, that we all draw on the same research about what works and what doesn't, what's efficient and what isn't, what's ethical and what isn't. And then we come to the same conclusions, that there are a number of things that if you do them, the probability of your intervention working, being efficient and effective and being ethical is increased. So if you choose to call the intervention something else, it doesn't matter. It's applying the principle. That's what counts.
Yeah. So we know you had experience as a special advisor of WHO. You were appointed as a consultant for Greeks. So that was quite an experience.
Yeah, I was lucky enough. I worked in Greece about 7 or 8 years ago now, for quite some time, about 6 months or so, working on the kind of health reform process. I was asked to work as a WHO consultant, developing an internal and external communication and marketing strategy in relation to the health reform process in Greece. Yeah, so I spent a lot of time in the Department of Health, meeting ministers and senior officials, and interviewing people like nursing leaders and hospital leaders, pharmaceutical leaders, and so on, to understand the process. And we developed via WHO some guidance for the Greek government. So it was an interesting experience.
Quite an experience.
Yeah. It was. Yeah. And it was in the height of the kind of financial crisis as well in Greece. So having a backdrop looking out of the window of the demonstrations that were going on certainly made it a kind of an exciting assignment.
So we know your time is precious. At that point, we should ask that if someone has a question, should apply it now, because we are close to an hour.
If there are any questions, I'm happy to deal with them.
As we discussed, we can wait some minutes. Kosta, do you think that governments, Kosta Zap asks that, do you think that governments have informed citizens properly regarding all the different phases? Was and is the communication around the pandemic efficient, especially for the phases that will follow? In this case, would you say that the responsibility of the citizens is even more important during the follow-up and after the lockdown? There is no war, so I'm confused. Especially for the phases that will follow.
Yeah. In general, I think lots of governments have done quite a good job of informing citizens about what they know and what they should do in the early phase of COVID. And in most countries, including Greece, there's been a very positive response to that guidance in the short term. But what we know is this is not a short-term problem. It's a medium to long-term problem. If we take the best case scenario and a vaccine is developed, it will still be over a year before everybody has access to that in Europe, probably.
So we'll live with this.
So, sorry, Leo. So, I think in the early phase, governments have done a good job, but that in a sense, that was the easy job. The more complicated job is coming now. It's when we start to open up, and the message is not just, stay at home. It's more nuanced than that. It's more complicated. We have to engage with people more about if you're going to open a shop or a school, that's not 100% risk-free, even if you social distance and wash your hands and so on.
Yep.
And we need to have that more adult-to-adult conversation with people and engage people's own ingenuity and common sense to reducing the risk as much as we can. And so it's not such an easy message to get across. It's more about a dialogue and talking with people and jointly working things out.
So, as a title of, to summarize, as a title of this discussion, the title was about for government responsibility to government and community responsibility. That means that also people should engage by themselves. They have a responsibility.
Absolutely, yeah, absolutely. This is not just about what's happening around the world now as we move into these latter phases. Is there's within every country, I'm sure it's true in Greece, there's criticism of the government, whatever government, even governments that have done, countries that seem to have done quite well at the moment, like Germany and Greece and New Zealand, Australia. Even that, there's mounting criticism in those countries of governments. So this is the kind of, the tricky phase. And for me, the solution to this is a community-driven solution. So that means citizens not only have, their rights to be protected, but they have a responsibility to make a positive contribution to protecting their health and the health of everybody else. So I think that's the kind of dialogue and conversation that needs to be fostered by governments now. It's about how do we work together, all of us, everybody has a responsibility to solve this and to reduce as much as we possibly can the harm that is associated and flows from this virus. It's not, governments can't fix this on their own.
Yeah, of course.
The governments and the people.
So we have another question from Angela. How can you measure ROI in a country like Greece where transparency in health spending is limited or non-existent?
So, just repeat the question for me.
How can you measure the ROI of investment, the ROI in a country like Greece where transparency in health spending is limited or non-existent?
Yeah, so the question is about how do you measure return on investment in a country like Greece where some of that it's not immediately obvious where all that spend is. Well, what you do is you measure what you can in that situation. You will have you'll know what public health department spending is. You know what any special government spending is. You'll know what percentage of time of various professions is being used to tackle this issue, and you add up those input costs as much as you possibly can. And if you ideally, and Greece has many health economists, you work with health economists to work out the costs of each death or each hospital episode, and you see what the ratio is between that input and that output. So it's not going to be perfect at all, but you should be trying to track the efficiency of what you're doing, because if that's not even on the agenda, then what's probably happening is you're probably spending money and resource time on things that maybe are not being effective at all, or worse, maybe making things worse than they are. So there should be some effort to track the input that you're putting in, and health economists can help with measuring even things like social input. If you're getting community input, what's the economic value of that to solving some of these problems? So it's not easy, but I think it should be attempted.
I think we don't have any more questions. If you wish to make a closing remark.
Yeah, I'd be delighted. Well, again, thank you for this opportunity. It's been an interesting conversation. I hope you found some of it of some use. As we've said, throughout this presentation, social marketing, I think, can add some real value to delivering and evaluating programs, and it needs to be more systematically applied as we go through these phases of dealing with COVID-19. If we do that in a systematic way, we should be able to prevent some unnecessary deaths and the suffering that goes with that. But it's not an easy thing to do. It takes perseverance and will, and it's great that we're having this session, because I guess it means that there are some people out there that want to attempt to do that. So
your time is precious.
Yeah, thanks for that. Enjoyed it, and hope you have too.
We thank you very much for that you accepted. Your time is precious. We had more time than we promised. So the next part of this discussion could be in another time. Thank you very much, Professor, for the honor to be with us. Thank you.
Pleasure.
Good evening.